If you've been straining on the toilet, feeling like something is stuck inside you that just won't move no matter how hard you push, I need you to stop scrolling right now and listen to me carefully, because what I'm about to share could save you from a hospital emergency this week. There is a condition affecting millions of seniors every single year, and most of them don't even know it has a name. They call it just constipation. They think it'll pass on its own, so they wait. And then one day the bloating becomes unbearable, the pain sharp enough that they're calling their son or daughter in a panic, begging to be rushed to the hospital. I'm talking about fecal impaction. Stool so hard, so stuck that your body can no longer pass it on its own. And here's what scares me most as a doctor. Most patients had warning signs for days, sometimes weeks, before it turned into an emergency. Signs they ignored. Signs they were too embarrassed to mention, even to their own family. Today, I'm going to show you exactly what's happening inside your body, the early warning signs nobody talks about, and the simple fix that could keep you out of that hospital bed and at your grandchild's table where you belong. Let's break this down simply, the way I'd explain it to my own parents sitting across the kitchen table. Every single day, your digestive system moves waste through your colon using something called peristalsis, gentle, wave-like muscle contractions that push everything forward, step by step, until it reaches your rectum and your body is ready to eliminate it. In a younger, healthier body, this process runs like clockwork, almost invisible, something you never have to think about. But as we age, several things quietly start to interfere with it, and most people never realize it's happening until the damage is already done. The first change is simple biology. Peristalsis naturally slows down with age. The muscles lining your colon don't contract with the same strength or the same frequency they used to in your 30s or 40s. Waste moves slower, sits longer, and the longer it sits, the more water your colon pulls out of it, leaving you with stool that is harder, drier, and far more difficult to pass than it should be. This alone is enough to set the stage for trouble, but for most seniors, it's only the beginning. The second factor is medication, and this is the one that surprises almost everyone I talk to. So many medications commonly prescribed to seniors quietly slow down the gut without anyone warning you. Opioid painkillers are one of the worst offenders. They don't just dull pain, they dull the entire digestive tract. Iron supplements, often prescribed for anemia, are notorious for causing severe constipation. Calcium supplements, something so many of us take for bone health, can do the exact same thing. Even certain antidepressants and blood pressure medications carry this same hidden side effect. You could be doing everything right with your diet and still end up impacted simply because of what's sitting in your medicine cabinet. The third factor is mobility, and this one is deeply connected to independence itself. When you move less, when walking becomes harder, when sitting in a chair for most of the day becomes the new normal, your intestines move less too. Physical movement actually stimulates the contractions that push waste through your system. Less movement means a sluggish gut, and a sluggish gut means stool sits longer, hardens more, and becomes harder to pass. And the fourth factor, the one most overlooked of all, is simply not drinking enough water and not eating enough fiber. As we age, our sense of thirst actually becomes less reliable. So many seniors are mildly dehydrated without ever feeling thirsty. Combine that with a diet lower in fiber-rich foods, and you have the perfect storm for stool that becomes hard, compacted, and eventually stuck. This is exactly why fecal impaction is so common in seniors specifically and almost never talked about openly. It's not one single cause, it's slower muscles, certain medications, less movement, and not enough fluid and fiber, all working together against you at the same time. Before we go further, if you want more breakdowns like this one explained in plain language, without the confusing medical jargon most doctors throw at you, make sure you're subscribed to this channel, because every week we cover exactly what's happening inside your body and what you can do about it. Now here's where it gets serious, because fecal impaction isn't the same thing as ordinary constipation, and confusing the two is exactly what puts people in the emergency room. Let me tell you about Patricia, a 74-year-old patient of mine who came to see me after nearly a week of what she thought was just a stubborn stomach bug. She told me she'd been feeling bloated, slightly nauseous, and figured it would pass on its own like it always had before. What she didn't mention at first was the small amount of watery stool she'd been having every day. She assumed it was diarrhea, the opposite problem entirely, so impaction never even crossed her mind. By the fourth day, the pain in her abdomen had become sharp enough that she couldn't sit comfortably, and she finally called her daughter in a panic. Her daughter rushed her in, certain something was seriously wrong. What Patricia didn't realize was that the watery stool wasn't diarrhea at all. It was liquid leaking around a hard, compacted blockage that had been sitting inside her for days. She'd almost missed her granddaughter's engagement dinner that weekend, lying in a hospital bed instead of at the table where she belonged, all because of a symptom she completely misread. Patricia's story is exactly why I want every single one of you to know these warning signs, because the symptoms of fecal impaction are sneaky, easy to dismiss, and almost always mistaken for something else entirely. I see this mistake constantly in my practice, and I don't want it to happen to you or to someone you love. The frustrating truth is that this condition rarely announces itself loudly. It builds slowly, quietly, over days, and by the time it becomes impossible to ignore, many seniors are already dealing with a level of discomfort that could have been caught and corrected much earlier. The first sign, and the one people get most confused about, is straining on the toilet with little to no result. This isn't just ordinary difficulty. This is pushing, sometimes for many minutes, and feeling like there's something right there, just out of reach, that simply will not move. Some patients tell me they've sat for 15-20 minutes at a time, exhausted from the effort, with nothing to show for it. If this has been happening for more than a couple of days, your body is already telling you something is wrong, and it's not something willpower or extra effort is going to fix. The second sign is the one that fooled Patricia completely, and it's the most dangerous misunderstanding in this entire condition. When stool becomes severely impacted and hardened, your body sometimes produces a watery discharge that leaks around the blockage. Most people, and even some family members, mistake this for diarrhea. They think the problem is too much movement, when in reality it's the exact opposite. There's a hard blockage sitting there, and only liquid is able to squeeze past it. This is the symptom that sends people running to the pharmacy for anti-diarrheal medication, which only makes the underlying blockage worse since it slows the gut down even further. If you or someone you love has watery stool combined with no real relief and ongoing bloating, please don't assume it's a stomach bug. This single misunderstanding is responsible for more emergency room visits than almost anything else I see in this condition, and it's the exact mistake that nearly cost Patricia her granddaughter's engagement dinner. The third sign is abdominal pain and bloating that doesn't ease up, especially pain that feels like pressure or fullness low in your abdomen. Many seniors describe it as feeling like they desperately need to go, but nothing happens no matter how long they sit there. The bloating itself can become severe enough to make clothing feel uncomfortably tight, and some patients even mistake it for weight gain or water retention, when in reality it's stool backing up inside the colon. This pressure can become severe enough to affect appetite entirely, which brings us to the fourth sign. Loss of appetite is incredibly common with fecal impaction because your entire digestive system is essentially backed up. Food has nowhere to go, so your body naturally suppresses hunger as a protective response. Some seniors go an entire day eating almost nothing, assuming they simply aren't hungry, without realizing their body is reacting to a blockage that's been building for days. If you've noticed you or a loved one suddenly eating far less than usual, especially combined with bloating or straining, this is your body sending up a flare that deserves attention, not dismissal. The fifth sign is a persistent feeling of rectal pressure or fullness, almost like something is sitting right there that won't budge. Some patients describe it as the sensation of needing to have a bowel movement constantly, even right after attempting one, sometimes returning to the bathroom again and again within the same hour with no success. This relentless, unsatisfied feeling is one of the clearest signs that something is physically blocking the normal passage of stool. Now here is the part one needs you to pay very close attention to, because these next symptoms are not wait-and-see symptoms. These are symptoms that mean you need to seek medical attention immediately, the same day, not tomorrow, not after trying one more home remedy, and not after telling yourself you'll see how you feel in the morning. If you develop a fever alongside abdominal pain, this can be a sign of infection or a more serious complication, and it needs urgent evaluation. A fever combined with abdominal symptoms is never something to monitor quietly at home. If you or a loved one becomes confused, disoriented, or unusually drowsy, especially in an older adult, this is a red flag that should never be ignored. Impaction can sometimes affect the entire body when it becomes severe, and confusion in seniors is often one of the first signs that something internally has become serious enough to require immediate care. Severe vomiting, especially if it becomes persistent or comes in repeated waves, signals that the blockage may be more serious than simple constipation and could mean the digestive system has become completely obstructed. And if you find that you're completely unable to pass gas at all, not just stool, this can indicate a much more dangerous blockage in your intestines that requires immediate medical care, since it suggests the entire system has come to a complete stop. So how do you tell the difference between ordinary constipation, the kind that resolves with a little extra water and movement, and something that needs medical attention? Ordinary constipation usually means infrequent bowel movements, mild discomfort, and it responds within a day or two to simple changes like more fluids, gentle activity, or a bit more fiber at your next meal. Fecal impaction means straining without results for several days. That confusing watery leakage we just talked about, bloating that doesn't ease no matter what position you sit in, and it does not resolve on its own, no matter what you try, no matter how much water you drink or how many times you attempt to go. If you're seeing any combination of these signs, especially the watery stool combined with no real relief, please don't wait it out the way Patricia almost did. A simple visit to your doctor at that stage can resolve this quickly and safely, often with nothing more than a brief in-office procedure. Waiting longer is what turns a manageable problem into an emergency, and it's the difference between an uncomfortable doctor's visit and an unplanned trip to the hospital. Now let me tell you about another patient, Walter, 81 years old, whose situation became far more serious than Patricia's ever did. Walter had been managing chronic back pain for years with prescription opioids, and like so many seniors on these medications, nobody had warned him just how much they could slow down his digestion. He went nearly 8 days without a proper bowel movement. Brushing off the discomfort is something he'd deal with eventually. By the time his son convinced him to go to the emergency room, Walter was in severe pain, his abdomen visibly distended, and he hadn't been able to pass gas in over 24 hours. The doctors found a mass so hard and so deeply impacted that home remedies were never going to touch it. He required manual disimpaction right there in the ER, an uncomfortable, entirely avoidable procedure that left him shaken and exhausted for days afterward. If you're someone managing chronic pain with medication, or you love someone who is, please make sure you're subscribed, because next week I'm covering exactly which medications carry this hidden risk. Walter's story brings us to the most important part of this video, what you can actually do to prevent this from happening to you or someone you love. And I want to be very clear about something most people get completely wrong. More fiber is not automatically the answer, and in some cases it can actually make things worse. There are two types of fiber, and understanding the difference matters more than almost anything else I'll tell you today. Soluble fiber, found in foods like oats, apples, pears, and psyllium husk, dissolves in water and forms a soft, gel-like substance that helps stool move smoothly through your colon. Insoluble fiber, found in foods like raw vegetables, whole wheat bran, and many seeds, adds bulk to stool but does not soften it. Here's the problem: if you already have hardened, compacted stool sitting in your rectum, and you suddenly add a large amount of insoluble fiber without enough water, you can actually make the blockage worse, not better. This is exactly why I always recommend starting with soluble fiber and building up slowly, never adding a large amount all at once. Hydration matters just as much as fiber, and honestly, I'd argue it matters more. Most seniors simply aren't drinking enough water throughout the day, and as I mentioned earlier, the sense of thirst becomes less reliable with age. I generally recommend aiming for around 6 to 8 glasses of water spread evenly throughout the day, not all at once, and not relying on coffee or tea to count toward that total, since caffeine can actually have a mild dehydrating effect. If you struggle to remember, keep a water bottle within arm's reach and take a few sips every time you sit down. Gentle movement is the next piece of this puzzle, and you don't need anything intense. Even a short 10 to 15 minute walk after meals can meaningfully stimulate the contractions that move waste through your colon. If walking is difficult, simple seated leg movements or gentle stretching throughout the day can still help keep things moving. Magnesium-rich foods are another tool worth knowing about. Foods like leafy greens, bananas, and even a small amount of prunes can help draw water into the colon naturally, softening stool gently without the harshness of certain laxatives. Now, when it comes to stool softeners or glycerin suppositories, these can absolutely help in mild to moderate cases, especially when used alongside the hydration and movement changes I just described. But I need you to hear this clearly. If you've already gone several days without relief, if you're experiencing that watery overflow we talked about, or if you've tried a stool softener and seen no improvement within a day, this is no longer something to manage at home. Please do not attempt to manually remove impacted stool yourself, and please do not reach for harsh stimulant laxatives hoping for a fast fix. Both of these can cause real harm, including tearing or worsening the blockage. At that point, the safest, fastest, and honestly the most comfortable path forward is simply calling your doctor. If there's one thing to take from this video, it's that staying regular isn't just about comfort. It's about staying out of the hospital, staying independent, and staying present for the people who need you. Patricia learned that with a scare. Walter learned it the hard way. Don't wait for your own wake-up call. Here's something most doctors won't tell you, and it's what we're covering next week. The very medication in your cabinet right now could be quietly setting this up. I'll walk you through which ones carry this hidden risk and what to ask your doctor instead. Before you go, tell me in the comments, have you or someone you love gone through something like Patricia or Walter did without realizing it until it got serious? I read every comment, and your story might help someone else catch this early. If this video helped you today, hit that like button and share it with a parent, spouse, or friend who needs to hear it. Subscribe so you don't miss what's coming next. Your health and independence are worth protecting.